recorded, and we are recording. Yay! Perfect. Well, we might as well get started, and as folks jump on, they'll just jump on, if that sounds good.
Sounds good to me.
Well, do you want to take a moment to introduce yourself, and then I'll introduce myself?
Sure. My name is Melody Moore. I am the person who's the most excited to be having this conversation with Maris.
Oh.
I learned about Maris probably like most of you through actually seeing on Netflix that there was a video about something that I care so deeply about, and then being able to watch it and see her story and then reach out to her about something I was doing through an online summit, I think it was, right, through Embody Love Movement, and have an interview. And I told her afterward, wow, you have so much wisdom and grace and compassion and have been on this journey, and can speak to the resiliency and the complexity of what it's like to recover from an eating disorder in a way that I just wanted to tap into and share with as many folks as I could. So I'm a clinical psychologist. My specialty is in eating disorder recovery. And I use that word intentionally. A lot of folks say, I'm an eating disorder therapist. And I think, wait a minute, we are recovery therapists. I'm the founder of an organization called Embody Love Movement. We are all about resourcing any self-identified woman or girl to reclaim beauty on their terms and to redefine what it means to be worthy and to be whole through accessing tools of self-approval and of cultivating compassion for themselves and each other. And that's been my work for the past decade. I've been a psychologist for 15 years. And I'm also a yoga teacher. I teach around the country, and I guess in some other places in the world too. So I'm really grateful to be able to be here to speak with all of you, and to tap into the knowledge and the wisdom that Maris carries. So that's who I am.
Oh. Well, I am so grateful to get to share this space with you. And, for folks who are joining from Melody's community who we might not have met before, my name's Maris. And I similarly feel very passionate about yoga as a healing modality and the conversation around body image and eating disorder recovery, as that's why I came to the practice of yoga, was to find healing on my path of recovery from an eating disorder. And nowadays, I just feel really passionate about creating these sorts of conversations and spaces to have these conversations. Just because I feel like the more it comes to light and the more it becomes something we can discuss as a community, the more accessible the conversation becomes and the more healing happens. So I am just so grateful to have your wisdom, Melody, in this conversation and your hands-on experience and all the knowledge that comes with that. I think it's a really beautiful resource for everybody who is joining us or who's going to watch this later.
Thank you for that. Can we start with your shirt?
Oh, yes. This is my favorite shirt. It says, I am seen, I am heard, I am worthy. And it's actually a shirt from a nonprofit I work with called the Phoenix Project. And they create online accessible healing resources for survivors of trauma and sexual assault. And so, yes, it's very appropriate for our conversation today.
Absolutely. And that is the Phoenix Project, what you did the meditation on yesterday that someone was asking about?
Yes. Yeah. We, right now we rolled out what we're calling the COVID task force, and we're trying to create lots of online free resources as much as possible with everybody that we have on our team. We have things like meditations and things like, we're like crowdsourcing online resources for folks who are in quarantine but in an unsafe home situation, things like that. So wonderful organization if anybody wants to check them out.
Really important work. And where do people find those resources? I think they're on your Instagram.
Yeah, on my Instagram, there's a post and there's a highlight, and it has links to everything that we're working on right now. And you can follow them on Instagram as well, and they're always posting new things.
Should we dive into these questions we sourced?
Yes,
This,
yes. So for folks who are tuning in, we both, Melody and I, posted a call for questions or topics that people are chewing on right now. And so we have a list of things that popped up fairly frequently or things that we felt really drawn to discuss today. So we're just going to start with that. And if you have questions you want to throw in the chat box, this is a very fluid conversation that we'd love to have you be a part of.
and if you're just one request before I ask Maris this first question, if you're not muted, please mute. And then, unless you're going to say something. Otherwise,
yes, it's very helpful to have folks muted just for the sake of audio and just so everybody can hear really clearly.
Awesome, thank you. Okay, Maris, how do you focus on recovery and self-care when you don't have access to your normal routine and resources?
So everything in my life is out of routine right now. I don't know how folks are feeling, but I feel like I just don't even know what day it is half the time. And the normal structure I have for my days has been completely thrown out the window. And I think for a long stretch of my recovery journey, having a very, if not strict, but just very structured routine to my day was super helpful and supportive to me. And so it's actually been a little bit reassuring to go through this experience of having everything flipped on its head and realizing that I can find my footing. I can still practice that agility and be able to switch direction. But I feel like that's definitely come with time and practice. And so something that I would just throw out there is this idea that all of this around us is a really wonderful opportunity to just practice. And it's not about perfectly finding a way to do this where everything just quickly goes right back to a super smooth mode, but taking every day as just a way to collect more data about what serves us. I felt this today and I noticed that I did this, and I wonder if there's something else I could try tomorrow that would readjust that. So just as a broader way to start that answer, I guess, is just taking it as a big experiment and trying to be okay with there being a little bit of a learning curve during this time.
Yeah. Even a lot of a learning curve, I would say.
Yeah.
Right, given that it's unprecedented and we're learning together and we're learning differently and we're learning at our own pace, as we always do. I love that answer. I think a lot of what's happening is we're being reminded of how much investment each of us had already in the illusion that things were going to be however they were, that the things that we found reliable before were always going to be available to us. And this moment is making me go back to, have you read Pema Chodron's book, When Things Fall Apart?
No, I haven't.
I know you have Maris Reads, and you are such an avid, voracious reader.
Always looking for book recommendations.
And I know you know this philosophy. Yes, that book especially is one I go back to again and again. Pema is a Buddhist monk who talks about essentially things were never together. And it was our investment in things being, the ground being underneath us and the context and content of our lives being exactly how they were going to be. Always that illusion, we call it raga in yoga, the attachment, that we have this kind of moment where everything is shaken up. It's there's a gift in there eventually. I think we can come to it eventually of, okay, now I have an opportunity to really be present and really be in my body and in my breath with what is now, because every now is so different and so new. So I can really be alive to that. And with that, having an incredible amount of grace and compassion that, like you just said, this is not going to go perfectly. It probably wasn't even going perfectly with all of that in place. But at this point, with access to probably resources like therapists and dietitians, resources like yoga studios, resources like parks or routines or the food that you like to have access to, just not being available for all the reasons that maybe they weren't. And that's if you even had those resources in the beginning, but whatever setup was available being gone. I think the focus on recovery and self-care has to be prioritized even higher, given that there isn't as much bolstering it up. And that can be setting your mind and setting your heart to this. Nothing can come in front of this. Whatever comes in front of that, whatever becomes more important than my recovery will probably be lost. Everything has to be focused around this recovery if you're someone who's at all at risk of your eating disorder taking over. Just put it that way, right? Then recovery has to be prioritized and become like the highest value, even though you don't have access to what was normal. And then being really creative about what can my resources be now, right? Can I be open-minded and open-hearted to, there is support available. It's just going to look and feel very different than it did before. And I think for a lot of us, I'm used to going to a particular yoga studio and practicing at this time with this teacher and next to these people and in this way. And like, that's not happening for most of us. How can you utilize some of the online teachings? And maybe there's a gift there. Like now you could practice with Maris live streaming, and maybe you couldn't before because you don't live in Walnut Creek. So there has to be holding recovery is the most important thing, and allowing yourself to be flexible and creative about how can I perceive this as support differently? How can I let in things as support now that maybe I wouldn't have been able to avail myself to in the past? And all of that in like a bath of compassion. That it's going to be clunky and it's going to be awkward. It's kind of like trying to get on Instagram Live this morning, and we were just like, it's definitely not working. So instead of beating our head against the phone, how can we pivot and create a new framework and allow something to be available, even though it wasn't what initially was intended?
Absolutely. I think that's just such a beautiful way of putting it. And like the way that it's coming together in my mind is like we all collectively have this beautiful chance to expand our toolbox. You know, like you get really comfortable with the very familiar and supportive, like not to undervalue them, resources that we've been, you know, utilizing in the past, but now is a chance to maybe look and see what was out there that we just didn't have our eyes open to because we were in this one place. And that can be a really challenging thing, but it can also be a really beautiful thing. And it's one more thing to keep in your back pocket for when the situation or circumstance inevitably changes or shifts in the future, then you have even more resources to draw from then.
Yeah, I mean, in a way, I know this is different because this moment truly is unprecedented, but you've had some of this already, I would think, Maris, because you were in recovery in a certain place in town, and then you moved and continued your recovery, right? So I love how you put that, like then your toolbox expands.
Right, yeah, absolutely. I mean, when I began my recovery, I was living at home with my parents. I was 14 years old. You know, I had a very set structure of like when I would see my therapist and when I would go to school, and everything was as it was. And not too many years later, I completely moved away out of my parents' house, started college, away from the therapist I'd been seeing for 6 years, you know. Those kinds of shifts, they do happen. And I remember that feeling of like, what am I going to do with everything that I have built and relied upon suddenly not being as readily accessible? And that feeling it can be really, really scary, but at the same time, it did create space in my life for new things to enter. And that's something that I can now view with gratitude, and also hold and honor and recognize the fear that came with it. You know, there's gratitude for what comes as possibility, and it's okay to acknowledge that it can be scary and really challenging.
For real. And it's probably necessary to acknowledge that it can be scary and really challenging. Again, like giving ourselves grace to like, right, that was frightening, and being able to build on the experience. Like, I think it's hard in this moment to remember we've done hard things before. I know that phrase is getting thrown around a lot. But for anybody in recovery, you've actually already done some really difficult work. This isn't the first time you've been met with an overwhelming challenge, right? And so remembering, tapping into what resiliency has been built, what capacity has been built already because of challenges you faced and conquered, or at least navigated successfully enough to be in this new now, this new moment. All of that will work for you today. Like that which is within you is still here, even though everything around you has shifted. You've still got all that capacity, and it's with you. And I think remember, like, stopping and slowing down to remember that, which you already have, hopefully could provide some self-trust.
Mm-hmm. Oh, that's such a beautiful reminder. And like what also comes to mind is a lot of folks, maybe yoga is a part of your recovery or just a part of, your life, your self-care, your self-study, and to have it interrupted where you can't go to the yoga studio at the same time, or you don't have access to the same teachers. It's just a reminder of like the yoga practice has been preparing you for this moment, and it doesn't have to happen just in the yoga room in the exact same way. Like it has been preparing you to adjust and shift to times of change, to be in the flow, to practice, adjusting and giving yourself additional support where you need it. And so this isn't a time where the yoga practice is halted. Like this is the time where it really comes into action and it really gets to be practiced in a different way. It's like you have the practice, you have the tools, and you're still in a state of practice. This isn't a performance that has to go any certain way.
That's right. And I love that you mentioned, like, this is why we practice. all of that was for moments like this. I've been doing this. This is another like gift of the opportunity to be flexible. There's a woman named Gina Caputo whose Instagram is Yogini on the Loose, and she's doing every morning, which I'm someone who really appreciates reliability and anchoring into ritual. It's really useful for me, and I would argue most people. But Gina Caputo has been doing 8 a.m. PST, 9 a.m. MST. She's in Boulder, Colorado. Kind of like a short Dharma talk with a light flare. She's really authentic and down to earth and like tells it like it is, and then followed by a meditation. And the other day, last week, she was talking about like this is how we develop the grit of the practice. This is why we stay in poses like, I think she was naming pigeon. And I was thinking about, if you're someone who practices yoga, reverse triangle, because to me, it's like you're in that twisted, wild pose. If you don't practice yoga, it's like this wild, where your body's being pulled in 4 different directions, actually 6 different directions at the same time. And somehow we practice staying and breathing, even though we're being pulled or pulling ourselves into 6 different directions. And that muscle being built up of being able to utilize now the grit that we've grown through being in those places, whether for you it's like a hip opener or it's a it's twisty. I think we're really giving ourselves a chance now to see how that could serve us.
Beautifully said. And like, if you're someone who has been practicing for a period of time, I mean, think about all the ways that your practice has changed and evolved and had to adapt to the circumstances of your life. I think like I started practicing when I was 14. My practice looks and feels very different nowadays than it did when I was, a young teenager. And like, it's just adapting to what I need, whether that's, the periods where I've been very drawn to like a rigorous vinyasa flow, or the periods where I've gone to solely like a yin and meditation practice. Like we have practice switching the tools that we need at the time. And this is a chance to really, expand beyond the mat even, to one, shift our practice to what we need, but also to look around and evaluate what other parts of our lives we can navigate and shift with grace.
I love that. Okay, this is a good segue. Is yoga a replacement for therapy / eating disorder treatment?
I mean, I would be really curious to hear your thoughts on this as we dive in.
I'm a hard no on that. I'm really a
I
hard
had
no
a
on
sense.
anything. I'm a hard no on that one. It is not. It is not. It's an easy bypass if we use it as a replacement for treatment. For folks who are really struggling, who are having invasive and intrusive thoughts, who are leaning in to the urges to restrict food or to binge food or do whatever with food that's playing out what's happening on an emotional level. Yoga can actually be used to serve an eating disorder. It's a double-edged sword that way. And I've been practicing for 20 years. I love yoga, and it's not enough. Really, it can be used to propel an eating disorder in certain ways because you could use it to over-exercise, or I won't even say more because it could be triggering, right?
Mm-hmm.
Instead, along with, as an adjunct to, or in partnership with eating disorder treatment, then yoga can be used to develop proprioception, to find presence, to develop spaciousness, to find, like we were just talking about, ways of being with hard things and finding ways to tolerate, accept, and later even be grateful for. There's so much to say about the benefit of yoga, but I'll make it brief so it's not overcomplicated. It is not a replacement for eating disorder treatment for somebody with an active eating disorder. But I'm curious about your experience, Maris.
We're in full agreement. I mean, this is a question I get very often. And I think something that I am aware of in the way that my story is often shared is that I don't want it to come across as me saying, like, just yoga harder, like you don't need other support, whether that's, whatever mental health experience you're going through, whether it's medication or therapy or inpatient. I never would want to put out the idea that you don't need those things, you just need to yoga harder. Because I think that really establishes a hierarchy of healing. Like there is somehow a superior way to heal or a pure way to heal. And I don't think that serves anyone, that idea. I think that we all have unique needs and circumstances, and whatever you and your support decides is the best route for you, like that is what's right for you. And that can evolve and grow over time. And I say this as someone who has found an incredible amount of healing through this practice. But the way I've always viewed yoga's role in my recovery is that it shows me where my work is. It can show me where I have space to grow. It can show me where I can try on and embody things that I'm learning through my recovery. But it's not something that just is like an easy magic button where I just go to yoga and everything's fine. I think that it is a practice, and it can be a beautiful complement to recovery depending on how it shows up and where you're at. But I don't see it as a replacement, just like you said.
Yeah. And there's also, I mean, as you're talking, I'm thinking about the danger of what we mean by yoga. This is a different Zoom conversation, but that's a really broad. So, so that could be dangerous too. Even thinking about how somebody's defining yoga and like, this is my treatment plan. Oh no, because that is maybe a limb of the 8-limb practice. Like, I'm so happy for you, Maris, that the people that you found to support you and to teach you about yoga are folks who, I'll let you speak to it, but that seem to me, not knowing them, have really instilled in you, this is a practice that includes ethical principles, it includes yama niyama, it includes ways of treating yourself and others. It's a philosophy, it's grounded in breath work and in meditation. It's not about moving your body into certain shapes and perfecting those shapes, which is some people's understanding of yoga, which is why I'm saying that's even more dangerous as a replacement for treatment.
Mm-hmm. Yeah, absolutely. And like, just to call their names in the room, like the initial teachers that I met, Jenny Wendell, Jessica Micheletti, Malia Hill, Nicole Harrow, they would begin with the philosophy of the practice. That was what was forward. And so whatever, preconceptions I had about yoga being solely a physical practice, like that was thrown out the window day one. And it was something they constantly reaffirmed and integrated into my time with them. And so I was very lucky to walk immediately into a practice of yoga that included self-study and the philosophy, and wasn't just about moving in a way that could easily fall into trying to meet a perfection or a certain standard of the body, which could be incredibly harmful to someone's recovery journey. So yeah, it also certainly depends on how the yoga is being, taught and shared in practice.
Yeah, that's right. I like all these segues. You want to go next?
I know, it's working out very well. I think one that has come up a lot, so it's definitely something that I want to get into this conversation, is a fear of weight gain or body changes during this time of quarantine or social distancing, where folks are at home, maybe their movement patterns have changed, their access to food has changed. I've heard and people have shared with me their fears and challenging feelings around body changes during this time. And I would really love to hear your thoughts around that.
Yeah, I think this is like the most asked question that both of us got from our community. I'm certainly hearing from my clients as well. And I think there are a lot of ways to meet this question, but I'll start here. If we can be like Rumi's Guest House, right? This poem that says, every moment a new arrival comes, greeted at the door laughing. It's essentially like this human being is the guest house. And fear is one of the things that's going to show up for us. How can we meet that fear of gaining weight as a fear, with compassion and with understanding and with curiosity? The thing I think everyone's asking is, how do I not feel afraid of this? And I don't know that that's a realistic question. How about we meet that I am afraid of this happening, which isn't new for somebody, likely for somebody with an eating disorder to be concerned I'm going to gain weight. That seems like a part of the kind of body distortions that come along with having an eating disorder. It's probably there already, and now it's heightened. So how can we meet that fear with curiosity and with compassion? In other words, could we get really creative and interview the fear? Why are you showing up? Where are you from? What are you offering me? How might you benefit me if I believe you? And if I work with this fear and act as though I believe it and I would be harmed? And asking the really pivotal question of, how are you helping me? How are you supporting me? Because if you can get access to that answer from your own fear, so I realize now you're interviewing yourself, but that's self-investigation, as you just mentioned, it's Svadhyaya. If you can get access to the answers of what the fear is doing for you, then you've got a nugget, you've got a gem to be able to understand, okay, you can now get those needs met perhaps through other ways than what that fear would be telling you to do. Somebody with an eating disorder, the fear is going to tell them, you're going to gain weight, and so, right? Fill in the blank. And so do this, don't do this, basically. And so all these rules that need to be followed in order to not have the outcome of weight gain. But if you can get curious about fear, sit with it, ask after it. What are you trying to protect me from? How are you here to help me? It may be able to guide you into answers like, I feel completely lonely and disconnected from people. Okay, well, meeting that need is different than meeting a need not to gain weight, right? Or I'm scared about what's going to happen to my income, to my family, whatever that's about, and being able to sit with that and meet those needs differently, like meet the actual need. Because a lot of times the hovering fear around gaining weight, not always, but mostly, it's actually not about the weight at all. That's actually not the fear. That's just showing up on the surface because it's such an easy target. And if you have an eating disorder, you've probably been conditioned. It comes with like the soup of the eating disorder. That's going to be it's just part of it. It's inherent in it. That's going to be a fear. So I would say getting really curious about, like, is this even the question that I should be asking myself for my sustainable recovery, for my sustainable well-being, for my sustainable sense of calm and peace? And if not, how can you dig into, with curiosity, again, with compassion, what are you really asking and what are you really after? And maybe there are ways that those needs ultimately can be met. So
Mm.
I'll start there.
Oh, I beautifully said, and touched upon like the feelings that are on my heart around this same idea. And so, not to be redundant, I'll just share an anecdote of when another time that I've experienced that process is actually when I went away to college. And that was a challenging transition. And I noticed some disordered habits and behaviors re-arriving in my life. And I, got on the phone with my therapist, and I felt like I was confessing, like, I've messed up my recovery. I'm a bad person. This is bad of me. I should know better by now. I've been in recovery for a while. And I thought she was going to, it felt like I was getting in trouble, like I was fessing up to the teacher that I had cheated on the test. And instead, what she offered was that advice and compassion. And she said, this is just a chance to ask what you need. And instead of, suppressing and being angry about those kinds of thoughts or behaviors re-arriving, it's just about seeing, oh, this is an indicator that I need something. Some part of me is asking to be seen and asking for some kind of support. And it's a really beautiful chance to just get more familiar with what I need right now. And I think having that experience it wasn't a blip in my recovery. It wasn't like, oh, I messed up that part. Like, it was an important and necessary part of recovery. It's important and in many ways, unforgettable part of the process that's always evolving, just getting to better understand ourselves.
Yeah.
And so this can be viewed as, an opportunity to try on that process of witnessing a challenging emotion or behavior arise, and to maybe go a little bit deeper and learn more about ourselves and how we can be taken care of in this time.
Yeah. And I love that you named, essentially, recovery is not linear. Those moments are necessary. They're not slips, they're not relapse, they're actually part of the whole journey toward recovery. And I have a friend, Lauren Fleshman, who on her website, she's a pro athlete. She's retired now, but on her website, she has this really cool, instead of like her bio, these are all the things I've done well. And she has all these titles and national titles and world records and whatever. It's all right. But instead of that, she has this like really messy drawing with like, this is where I had foot surgery and couldn't run for 3 months. And then this is where I failed at this. And this is where this challenge came. This is this one. And it's all over the place. And I always think that's what recovery looks like. That's what everybody's recovery journey looks like. It's messy. It's chaotic. It's not always headed north. It's not linear. And can we allow that all to be part of the experience toward recovery, instead of assuming, oh no, this fear has come up, and so I'm off my game. Because what can happen then, right, is shame. And well, we know what happens when shame sets in. More of the same negative and self-sabotaging behaviors, essentially. It's like seals the deal on this isn't heading in the direction that I would ultimately want for it to, that the highest part of me would want for it to head. So I'm really happy that you could name that antidote of, yeah, this comes up and it's all part of the process.
Yeah, absolutely. And like, also what I'm hearing from folks in this experience is not just the fear of weight gain or body changes itself, but the guilt around having the desire to lose weight or manage their body. Of like I read about recovery things, and I practice yoga, and I go to therapy. Why do I still have this feeling? And like, just permission and recognition that this is an experience that we go through. And in a society where we put so much emphasis on bodies, and we put so much emphasis on, bodies behaving a certain way, like, it is, understandable that those kinds of feelings arise, and it's not something that it reflects poorly on you or your recovery that comes up during this time, especially with, I, at least my experience, watching the world, like this community's reaction to the current state of the world. Like, the immediate thing was people were rolling out at home workouts and, like, tips for eating a certain way during COVID. And It's like when you're inundated with that amount of information, which in many ways can be supportive and helpful to some folks, in other ways could be triggering for other folks. Like it's natural that you internalize that and you think, oh, well, people are reacting this way. Should I be reacting that way? These resources are available. Should I be using them or not? Like it's natural to have this kind of experience, and it's nothing we need to feel guilty about. It's just something we can investigate and dive deeper into.
Yeah, that's right. And just to name, because there's this, I don't know what to call it, like a low grade anxiety that seems to be permeating our context and our environment in general. The ways a lot of us have learned, have been taught, have inherited, or have developed of how to manage anxiety, how to manage overwhelming emotion, how to manage any discomfort, really. One thing a lot of us have reached toward to be able to feel like we have some influence over our internal landscape, our feelings, is toward eating disorder thoughts and behaviors. Mm-hmm. And the wish and desire to control the way that our body looks is just that, right? Whether you have a formal eating disorder diagnosis or not. And so I think it needs to be named, like, of course your mind's going to go there. My mind's going there. Of course it's like inevitable. It's predictable. Your mind's going to go toward, I can't control what's happening in the world. I can't control all of any of the system, not only the virus, but also the impacts of the virus, the way that certain individuals should be managing it and can't or aren't or whatever, all of that, right? And all the unknowns. How most of us have developed, I'll call it a skill, is to really transfer all of that worry and all of that overwhelm into, but baby, I can make this body look a particular way. I can make sure I eat only this, or I can soothe myself through eating as much as I possibly can, or through eating these things to feel better, right? And so just to be able to acknowledge, like, yeah, that's inevitable, and that's okay. It's okay that your mind takes you to that place of I'm wanting to control everything else through something around my weight or appearance or food behavior. I think, again, I'll just keep saying this because I think we all need to keep hearing it. Me too. Just having grace for that, having an understanding of that. Like, of course. If you haven't read the book, I'm always like spitting out book recommendations.
I love it.
The Four Agreements. Don Miguel Ruiz wrote this book years ago, The Four Agreements. And one of the agreements is always do your best, with an understanding of that best is relative, that your best outside of quarantine, outside of social isolation, is going to look really different than your best in it. Just like your best, it all depends, right? And so having that kind of compassion and that kind of understanding, I'll just say that about it, that what's coming up for you right now it's probably very, I don't love the word normal, but understandable and predictable given the situation that you find yourself in. It brings us to this. Unless you want to say something else about that, Maris.
No, I love that reminder. I just beautifully said.
Okay, good. How to balance the feelings of positivity / gratitude / empathy with feelings of fear, worry, anxiety during COVID-19.
Yeah, this is something that I've been chewing on personally too. Is there's a tendency right during this time to look for silver linings and have gratitude, and that is so important, has been so helpful, at least to my well-being during this time. While at the same time holding in reality the simultaneous experience of fear and worry and empathy and fear for folks who are maybe in an even more challenging situation during this time. And so, like, trying to find a balance where you don't want to deny either one, but also not lose sight of the other one. It's been something that I have personally found to be challenging, or another way to put it, a really intense practice of mindfulness over this time. But what has been constantly coming up for me is this reminder of yoga being so much dealing with paradox. And so like yoga being unity, it's not about things having to exist in separation and isolation, but like holding in a unified experience things that might be in a paradoxical relationship, feeling love and compassion that I am in a wonderful home right now and having even more present time with the important people in my life, and at the same time experiencing fear and anxiety. That has been a practice of yoga for me, is holding both of those in union and honoring them as equally meaningful experiences.
Yeah.
So I think that I am still navigating the tools that have been helpful for me. But what has been ultimately helpful is just being, or allowing myself to say, and, I feel gratitude and love, and I feel fear and worry. And those are things that I can experience as a complex human being. And it's not a negative thing to have both in my life right now.
Totally. I love that. The sacred and.
Mm-hmm.
And is the magic word. My friend Nikki Myers, founder of Yoga for 12-Step Recovery, talks about that all the time. And it depends. Both. So we just have to hold those words with so much reverence. I think the only thing I would add to that is I don't know that we can balance our feelings. I don't know if this is what this question really meant, but when I read it, I'm like, well, hold on. We don't actually have choice over how we feel. We have choice over what we do with our feelings. We have choice, in other words, of how we respond, what we put to words, what we put into action. And I would say we have some choice over how we think, or at least how we respond to thoughts. And as we continue to develop our meditation practice, we have choice over what we think. But how we feel, that's just coming. And to shame or guilt ourselves around how we're feeling and what we're feeling and when we're feeling it or how much of it we're feeling probably isn't useful, because it's going to continue for everybody. There's no level of I've graduated to being able to pick my feelings. And so let's not plan for that. But rather, just like you said, Maris, being able to hold more and more at the same time, to be able to recognize the complexity of being human and the complexity of our emotions, recognizing none are bad or awful or wrong, and none are good and wonderful, right? There's not a moral level system around feeling. So letting them all be welcome, letting them all be okay, and letting them happen simultaneously. Like you said, you could be having fear and gratitude at the same time. You could be having overwhelm and calm at the same time. And you could have all four of those plus at the same time. So really more of one meditation practice, actually my writing teacher, Jen Loudon, taught me years ago, is just naming this too, and allowing for that, this too, fear, this too, overwhelm, this too, gratitude, this too, instead of trying in some way to put them in boxes and make some better and some worse. Might be easier.
I love that.
Yeah.
Oh, it's something that I often say in my classes when I teach, is just like, you have permission to feel whatever you're feeling in this room. Some people might be laying in Shavasana feeling absolute bliss and just feeling totally content where they are. And if you're laying there restless or fearful or uncomfortable, like, that's also welcomed in this room. There is no need to suppress or deny feelings that you don't think fit the context of the experience. Like, what you're feeling is held here, and it's safe to feel it. And I think that's a reminder, another chance that we can take, what we're practicing on our mat and bring it into our everyday lives even more presently in this moment.
Mm-hmm. Yeah, there is no separation from on and off the mat. Yeah. Okay.
Let's see. I also want to be present that it's after 11, and I just want to be mindful of your time. I'm good on time, but I want to make sure see where you're at.
Thank you for that. I will have time for lunch before my noon. I think we were planning on an hour, and since we started at 10:30, you want to go to 11:30?
Yeah, that works just fine for me.
Okay, great. Thank you for asking. We're in PST, y'all. I know that I know we're in EST, so when I'm naming numbers. That's all relative.
Okay, well, um, let's see, there's something that I found to be really interesting that came up that I would love to dive into, is the question of how to effectively basically set boundaries with people that you're cohabitating with at this moment, maybe even with more presence than usual, around, what you need in terms of talk around body and food and exercise during this time. I think I would be really curious to hear your thoughts around that.
Yeah, and I hear like the second part of that question is it's stressful. Like,
It's
yeah,
stressful.
it's
Yeah.
really stressful. Pia Melody talks about hard boundaries and soft boundaries. And where soft boundaries, first of all, boundaries, that's an unfamiliar term. This will change your life, but hopefully it's not too unfamiliar for most folks. Boundaries are, an understanding of this is where I start and stop, and that's where you start and stop. And between those two places is a boundary. So it's like a psychological, emotional shield that you could envision as being a door, where a hard boundary is like a triple locked safe metal door, and no boundary is just like the door is wide open at all times. And a screen door is there's a lot of choice here about how much I'm going to let in and how much is going to leak out or choicefully, responsibly be let out. And so boundaries shift based on circumstance, based on person, based on mood, based on time of day, time of month, right? We get to choose at all times what boundaries we are going to need in order to hold ourselves and others safe. So setting boundaries with the people that you're currently socially isolating with or quarantined with, or aren't, it might just be, you might be living alone and it's folks that you're, FaceTiming with or Zooming with or whatever it is that you're doing for contact. I hope you have some. It's really necessary. And for me, because it's so insidious, the way most people in our society, if you're in a first world country at all, have been taught to think and feel about food. It's part of living in a system where there is a moral imperative to be healthy, and there is a moral imperative to be whatever thin, and that somehow is deemed as better or more valuable for all the reasons. And we don't have time in the next 10 minutes to go into the patriarchy and misogyny and racism and all of that. And that's part of the same system that makes us feel, a lot of us or a lot of our families or the people that we live with, free to speak as though there is a moral imperative around what we're eating or not eating or how we're moving or not moving, et cetera, how we look. So for me, because that's true, and most people say things without intending to cause harm, without any consciousness around that it could be harmful. In fact, most people say things thinking that it's helpful and thinking that they're being in some way supportive or encouraging to talk about somebody else's body shape or size or food behavior, movement behavior. For me, because of that, it's really necessary to set a very, very hard boundary. And I believe, and in my experience working with my own family, which is a tricky one, I'll just say, hard boundaries have been the only thing that have worked. I tried the soft boundary. Soft boundary is making a request. It would be helpful to me if we didn't talk about what I'm eating or not eating. That's a soft boundary. It would be helpful to me if you didn't ask me whether or not I worked out today. Or it'd be helpful for me if you didn't tell me how many calories you burned, how many steps you walked on your Fitbit, right? That's a soft boundary. It's making a request. Because in my case, and I think a lot of our cases, those boundaries get thrown out the window. They don't get honored, not because we're not loved, not because the person isn't wanting to be supportive and helpful, but more so because, again, the system that we've been swimming in says this is useful information and this is great fodder for conversation. And I'm just doing my best to help you, whether this person knows you're in recovery or not. And even if you're not in recovery, I have found that it's really useful to set extremely hard boundaries and say any conversation about the way anybody looks, me, you, the people on the TV or on the social media, this stranger, any conversation around appearance at all, any conversation around food behavior at all, or movement/exercise behavior at all isn't useful to me. It's not what I want to talk about. It's not supportive for me, and it's not supportive for you. whether or not you, whoever you are, can recognize that in this moment. Know that it's a hard boundary for me. I'll even use those words. If those words don't feel like something you would ever say, find other ones, of course. But for me, it's essential, or it's imperative, or it's necessary. I won't be able to continue our conversation if those things are spoken about. And for me, it's been easier to set just really strict, rigid rules, which I'm not a strict, rigid person, around that, in order to help the people sort themselves out. Essentially, in order to help the people actually be able to give me the support that I've needed, or to be able to give clients of mine the support that they've needed, I've had to be very, very clear. Like with parents that I've worked with of teens in recovery, of like, no, not even that's helpful. No, also not that comment. No, not comments about you. Well, my kid's not comparing themselves to me. Yeah, they are. Not even that, right? So to me, it's like as clear as you can be in making these not soft requests, but hard boundary request, and really drawing the line in the sand of like, the only way I'm going to be able to be in this with you is if you protect me in this way. I think is the most useful. But Maris, I'm really curious about what's been helpful and supportive to you, and how you would answer this.
I mean, you provided such helpful advice, and I think the only thing that I could add, I can maybe think of two things. One is that I have previously experienced challenges with setting boundaries because I feel like it makes me a selfish person. And something that I've had to learn is that love shows up in many ways, and my love and compassion for someone can show up through a boundary. So the way that I can preserve a meaningful relationship with someone and feel comfortable sharing space with them, it might be by setting a boundary that can feel challenging. And it's not a way of shutting someone out. It's a way of strengthening a relationship. And I think that's something I've had to learn and reaffirm over time. But I think oftentimes boundaries are framed as like, oh, you're just being bossy, or you're controlling a relationship, you're being unnecessarily, prescriptive. But I think that framing of I, like, this is what I need in order to maintain this connection with you, I think that shows that this is just one way that love can be present in a way that we interact with people around us. And it makes things a little sweeter when we feel comfortable and safe and protected and held. Like that is mutually beneficial for everyone involved. And I would also offer, I don't believe that in order to set a boundary, you need to explain yourself, like, how like no is a complete sentence, right? But it can be helpful to help draw some connections for folks who might still be learning and understanding your experience. So for me, I've found it helpful to say, when we talk about body weight at the dinner table, I feel, insert whatever you're feeling. And just, feelings, like you said, like can't really be controlled in the same way they can't be argued with. I can't tell someone else what they're feeling. What they're feeling is reality, whether or not I agree with it. I think that just starting to even bring that language to the table and to bring that connection between what's happening and how I'm feeling into people's line of vision, I think that can be really helpful in making those boundaries feel loving, and at the same time emphasize how important they are.
So much yes to that. Double down. Do people still snap that? All of it.
I can't snap, but I feel the emotion behind it.
I want to invite anybody who's here to use the chat box if you want to ask questions. We have some more pre-written questions from folks, but if anybody's here and has a burning desire to ask anything, feel free.
Yeah, absolutely. And if not a question, just any topic that you, or anything you want clarification on, this is a conversation. Well, do we feel closure on that question? Do we want to move to another topic?
I think so.
Right. Well, I mean, we've talked a lot about tools and expanding our toolbox during this time. And one question that came through is how to begin a meditation practice, and feeling like everybody right now is saying like, meditate, it's great, this is the perfect time to meditate, but you feel like you just don't even know where to start. Folks were looking for guidance on beginning that practice.
I'm going to give an answer I wouldn't normally give, which is right now, if you have access, which you do if you're watching this, so we could assume that you do, to Wi-Fi and a screen of some sort, there are so many people who are actually offering guided meditations right now for free, accessible, and often. So this is what a wonderful time to tap into what does this look like to meditate, because it's something that's so ineffable. It's so difficult to describe, and something that has got to be experienced. Thinking about it and doing it are really, really different. So I'll say this: approach meditation as though you're going to get it wrong, and let yourself, because most of us come into the idea of meditation like that means I'm going to somehow be levitating and my mind will be clear and I won't think thoughts, and right, and I'll just be hovering in some sort of nirvana or bliss, whatever our mind can create around the idea of meditating. And what it's actually like is watching how many ridiculous and fast thoughts can come in all at the same time about some wildly different things all at once. And it's called the monkey mind. So that's the experience most of us have as beginner, and I would say intermediate meditators. It's like watching our thoughts, watching our thoughts, watching our thoughts. And this is still important. It's still a very important and necessary, and I think vital tool in recovery practice or skill, because if you can develop the capacity to witness your thoughts and to watch them come up and watch them swirl and watch them be the same thing over and over again, watch them be 1,000 different things all at one time, if you can develop that witness mind, then you also have developed the capacity to separate out the pop-up urge that says, do this, don't do this rigidity around eating, moving, all the things. You have just some space to consider, do I want to follow through on that idea in my mind? Or do I want to give it a pause, a sacred pause, to consider maybe the outcome? Or does that thought itself align with my values? And do I want to pull it into action or not? What are some other considerations, etc.? So even if your experience of meditation begins with 30 seconds of watching your thoughts and recognizing with the question of who's watching these thoughts? Oh, there's a part of me that's watching these thoughts. So there's a part of me that can witness myself. So I can see myself. That's everything. It's such a gift in moving toward a place of being able to access and utilize the tools of recovery. So I would say a lot of us resonate with different people. Like there probably are people on this call that are resonating a lot more with Maris than with me, which has nothing to do with me or Maris, just personalities. And that changes over time. So I'll give you a couple examples of people. And then Maris, I want you to talk about your own work and what you're offering right now too, if you're willing, and who else you're watching or listening to, if you're open to that. But again, Yogini on the Loose on Instagram. And so the story runs for 24 hours. So at any time you can tap into her most recent Dharma talk and meditation. I've been doing it. It's fun. It's light. Each meditation's about 10 minutes. She goes through the layers of kosha. And if you don't know what that means, she talks about presencing yourself to your physical body, to your breath, to your emotional body, and moves inward toward your witness mind and then your bliss body. So it's consistent, it's reliable, it's available, and it's guided, and it's free. Try that. Rolf Gates, who is probably my favorite person to sit meaning be guided in meditation by, is also leading free meditation Monday through Friday on Facebook. And you can go back because they're on his Facebook Live. So look up Rolf, R-O-L-F, Gates, like Bill Gates, but no relation, yoga. And he's also doing more like a 20-minute sit. But listen, like if 20 minutes feels like an impossibility because you're so busy in your quarantine life, one thing you could do is just do it for 3 minutes. Like start somewhere and let that be enough. So, I mean, there's a lot more to say about that, but I'll start there. So many people are offering guided meditations. Oh, one more thing. There's also apps on your phone like Headspace and like Insight Timer, etc., where you can access all kinds of meditation. So rather than sit with yourself, try letting yourself be taught and be open to being guided, because it makes the experience a whole lot easier and understandable. So I'm curious about your thoughts, Maris.
No, I mean, that was such a like whole and complete answer to me. You covered pretty much everything I would say. I would just offer that I do, we mentioned a little bit earlier during our conversation that I work with the Iron Phoenix Project, and they have lots of free meditation resources that are being pulled together right now. So that would be something to follow along with if you're looking for um, more resources in supporting the beginning of that journey.
Mm. And you've got some up too, yeah?
Yeah, I have a few. I've been hosting a few live through like Zoom in collaboration with the I Am Phoenix Project. So um, yeah, you can always follow along with me. There should be some more coming soon. Mm-hmm.
Now we have a whole bunch of questions on
I
chat.
know,
You're like,
and I'm noticing the time. Well,
oh.
I'm trying to, is there one that we maybe could cover in these last few minutes that you
Other
feel
forms of
drawn to?
self-care besides yoga to do during quarantine.
Hmm.
Um, one thing
Yeah.
is, one thing is, I was talking to a client about this yesterday, a client in recovery. Curate your social media,
Mm.
right? Curate it. She was saying, I think what's making me worse is that every time I look at my scroll my Instagram, this is what I'm being shown. And I was like, interesting. I'm not being shown any of that. Curate your social media. We forget we have choice in this, and whatever you're
Mhm.
seeing on your feeds on any social media, you're choosing. Besides the ads,
Mhm.
which are also essentially of your choosing because they're being molded to your likes and dislikes, right?
Mhm.
So if you're seeing images, statements, people that are discouraging of your recovery, unfollow, block, delete them, and notice what that feels like in your body. Notice what it feels like if you follow people who are encouraging of your values and of your recovery instead. Um,
Mm.
or just not looking at social media at all if that feels like an option for you. There's some real benefit of social media, of being in connection, like we've said, of finding meditations and yoga and just being in connection with people who are inspiring or encouraging or hilarious. I think laughter is a really good medicine during this time.
Mm.
But curating social media as a form of self-care, of not following whatever could be triggering, overwhelming, discouraging during this time.
Mhm.
I think another thing I'll name of self-care is connecting to friends. I had a double date with my fiance last night with my best friend in Austin and her wife. And it was so fun. Like, we've never had a double date because we don't live in the same state. But last night we were like, we should cook the same meal together and just sit down and be with each other. And it was really fun doing things like joint Zoom calls with D Nice or whatever, Ryan Heffington's dance classes, or like whatever else you can do to try to get visual contact if that's technologically possible for you. Because
Mhm.
there have been studies, fMRIs, about the kind of reception in our limbic system, the mirror neurons in our limbic system not getting fired up at all, which we want
Mm.
those to be excited when we just look at text, when we just look at a screen with words on it, versus when we get to have eye-to-eye contact. That visualization is what we really need, what our attachment system needs to feel held and supported and seen and connected. So giving yourself the opportunity for the healing, the medicine of connection, even though we're missing physical touch. And I'll just
Mhm.
say this before I toss it to Maris. Another thing you can do, right, is take a bath. Take your arms. This is something we do in EMDR, eye movement desensitization response. Wrap them around yourself like a gorilla in the wild, and gently tap like a rock, and tap like a baby would be held. So
Mm.
you can touch yourself in this way. Um, give yourself a hug in these times that you're missing physical touch, which most of us find incredibly healing. So
Mm.
3 ideas. I have more, but Maris.
No, those are beautiful ideas. I think other things that I have turned to is more creation of art with permission for it to be just for myself and not for anyone else's eyes. I think like relieving that burden of having to like produce something that is like, some kind of production. I think just permission to let things flow through in a wordless in a manner maybe, whether that's just like watercolor or doodling or, making something with your hands. I think that permission to just let emotion escape in a way that feels calming and like it doesn't have to be productive. That's been very helpful for me. Um, Other things, I mean, time outside can be challenging right now as we're trying to be responsible and socially distanced. But if you have even like a little patio outside your house, or a spot in a window where you can just feel sun on your skin just for a moment, I think that can be incredibly healing, even if it's just like 5 minutes sitting at your front door getting air in your face, if that's accessible. And then another thing is just time where, like, allotted time where you don't have to do anything at all. I think right now, at least myself, I have heard a lot of messages of, we have so much more time at home, like we should be more productive, write that book you've always wanted to write, or like start a podcast. And it's like, it's okay to have time to just lay down and take a moment. Like that can be totally fulfilling and productive in its own way. And I think just that permission for it to not have to produce something, I think that can be enough.
Absolutely. I love that answer. Well, I want to answer more of that, but we have so many questions. There are so many resources of yoga right now for the people who are asking about that, and you're likely being flooded with possibilities. I think flooded with possibilities. Maris, I know, is teaching online, so please put that in the chat or give yourself a plug around that for people who are watching the recording. My teacher and bestie, Sean Korn, is giving Instagram Live 9 a.m. PST Sunday Yoga Church. And her classes thus far have been, and I think will continue to be, really accessible. So if you're somebody who's new to yoga, this is a practice that hopefully you'll be able to access. What I like about and why I'm offering this practice is because, like we've said earlier, yoga is described and is understood as so many things to so many different people. Mm-hmm. And one of the things that really shifted and transformed my practice and made it therapeutic and made it holy was going into Sean Korn's class, because she uses yoga as prayer. She uses the body moving as a physical prayer. And that could be prayer to Mother Earth, your higher power, the universe, prayer for healing of this virus. And it could be prayer to whatever you consider as to be divine or God, truth and love that exists within, is how she would describe it. And so to me, this practice in particular is one that you might find very helpful and very healing, because it's infused with meaning and with intention and with a flowing prayer that you're yourself offering to you, to your recovery, to those that you have concerns about. So it's gorgeous in that way. I'll also say that your local yoga studios, most of you, have local yoga studios that have been incredibly nimble and creative to go live and to find ways to live stream from teachers' homes, from the studio, like 1 or 2 people in there, social distancing at a time. And it's really important, if you can, to continue to support your local yoga studios in some way so that they can survive this moment. And really for me, it's been nourishing to see my same teachers like on Zoom, and to see the people that I normally would practice with live. That can be its own form of self-care. And letting yourself also have access to, there are online platforms that are always available, that are still available. Weeding through those, I'd be remiss if I started to mention some, because I wouldn't mention them all. So let's mention Maris's.
Well, I mean, yeah, just like you said, there's so many out there, and if you can find a way to support studios that you have attended in the past, or studios that are local to you, small businesses are definitely being very affected during this time. So if you're able to support with their online offerings, that could be a really beautiful way to practice and build that community around it too. Well, that just flew by. I can't believe that it's 11:35.
I know, and we're sitting with all these questions, which means we'll get creative about talking about doing this again or how to answer them. I'd also be curious to know from anybody in the chat, or if we just end this through our Instagram messaging or however you contacted us, if you'd like to see more of this, or what other support you're looking for, if we can point you toward resources or creatively come up with them with each other in collaboration with others too, because it's hard to leave this with so many questions open. Right. And maybe that means we do it again.
Yeah, that's where my mind goes. Maybe we'll just have to do it again. Well, this conversation's been recorded, so I'll find a way to share and preserve it. And we would love to hear feedback, just like Melody said. So thank you so much for joining us and, being a part of this. At least I can only speak for myself, but I'm just so grateful to get to have a chance to do this, especially to share it with you.
Thank you, Maris, for that. And same here. I'm grateful. I'm really grateful. And I've learned a lot listening to you, and I know others have too. So thank you for this. And thanks y'all for being here and being in this community with us. I should say that Karen Gilmore is on this call, and she is doing nightly readings, bedtime meditations for children. She's an illustrator who illustrated lots of yoga books, including Thank You Body, Thank You Heart. And so she's doing readings from that and other things. If you want to wave, Karen, but seeing her, I'm like, if any of you are parents, you got to jump on with Miss Karen from Aloim Yoga in New Jersey and have your kids read too. This meditation is so beautiful. Yeah.
Oh, so sweet. Oh. Yes. Well, thank you again, everyone, and have a beautiful rest of your day, or start of your day, whatever time zone you're in, and I feel very grateful as well.
Thanks, Maris. Bye, y'all. See you soon.
Bye, everybody.